So, good day everyone. My name is Betty Hernandez, first year college from BSN 1D. So now I'm going to demonstrate to you the head and neck assessment. But before we proceed to our procedure, I will introduce myself to our patient. So, good day ma'am. I'm your student nurse for today. Yes. So, second, next we need to verify our client's name and age. So, ma'am, what is your name?
Vanessa.
How old are you, ma'am?
17.
Alright. Now, we will proceed in the procedure. First, we need to explain to our patient what we're going to do, why it is necessary, and how he or she can cooperate. So, the rationale is for the patient awareness in what we're going to do, why it is necessary. And so, good day, ma'am. I'm your student nurse for today. Now, I'm going to assess your head and neck. Is that okay to you?
Yes.
Alright. Next, we need to proceed in the wash hands or do the hand hygiene and observe other controlled infection procedure. So, the rationale is for us to avoid the spreading of microorganism or the cross-contaminations among patients or client or vice versa. So next, we need to provide for client privacy and place our patient in its appropriate position. So the rationale is for the patient to be comfortable in the whole procedure that we will be doing. For the privacy, we need to close the curtains, or if we are in the examination room, close the doors. And now to start our assessing to our patient, we need to ask some questions. So, ma'am, can I ask you some questions?
Yes.
Do you experience any problems with your face, head, or in your neck?
No.
Okay. Do you experience any problems with your thyroid gland?
No.
Okay. All right. After that, we need now to assess the head and the neck of our patient. So now I'm going to assess the head of my patient. So first, I'm going to start by looking at your head and your face. Looking also at the shape and size of your head, which is, based on my observation, it is appropriate for your size of person, and we call that a normal cephalic. And then I'm going to palpate the whole scalp, your whole scalp of your head, and I'm going checking for there are any lumps or bumps or any protrusions. So, is there anything hurt back here, ma'am?
No.
Alright, I see. So, that is there are nothing to worry. So, now I'm going to put my hands at your face. Is that okay to you, ma'am? And then, I'm going to ask you to please open and close your mouth. Okay, and close the temple, the mandibular joint. And I'm checking for any clicking or any crepitus or any pain. Do you feel any pain here, ma'am? Alright. And then, I'm going to inspecting your face. And I'm looking for any symmetry of the face. So, when I'm looking for the symmetry, I'm looking at the eyebrows, at the eyes, at the nose, and at the labial folds here, and the sides of the mouth, so it should be all symmetrical. So, if there is any one side of the face that was drooping, or it could be possibly a stroke or possible a problem with a cranial nerve number 7, which is the Bell's palsy. So now we're looking for any swelling of the parotid glands on the side of the cheeks, and then put your chin up, ma'am. For the swelling right here of salivary glands, or any swelling here at the base of the neck for the thyroid gland. Alright, that's good. And now we're going to assess the lymph nodes of the neck. So the lymph nodes of the neck, all of them, and sets, we will check them at the same time with the pads of the fingers using a circular motion. So here are the preauricular, the post-auricular, right behind and near the ear, and next is the jugular gastric, right here at the corner or the bone, here jugular gastric, and the superficial cervical, and the deep cervical chain all the way down to the neck. And then the posterior cervical all the way here. And so here is your cervical spine, and right here is your posterior cervical. And then the last set are the subclavicular. So here are the collarbones, and you want. So there you go. Into the hollow right there is where you feel those. Okay. So you can relax now. So if you feel a lymph node, then you would have to assess the location, the size, the consistency, the shape of those lymph nodes, and then you would have to investigate further. So, but it would be normal to not feel them all. For the last assessment, ma'am, can you put your chin up, chin down, and then turn your head side to side. Okay, and then put your ear to your shoulder, and then your ear to your other shoulder. Alright, good. So, your range of motion on your neck is normal. And we're done for the head and neck assessment. So, that's how I demonstrate to you the assessment of the head and neck assessment. So, after all the procedure, we will now document the data that we've gathered to our patient.